Here we introduce you to the basic guidelines on measuring techniques for lymphology garments. In the first step, we want to show you the procedure for the lower limbs. Hygiene is extremely important when directly in contact with patients. Remove your watch and all jewelry before taking measurements, as pathogenic organisms can colonize these. This will also prevent you from causing the patient's possible injury. Make sure your workstation is always clean and tidy, and disinfect the equipment you need. Clean and disinfect your hands before and after taking measurements. The yellow Medi measuring tape has been designed especially for measuring patients for flat knit compression garments. It is longer than tape rules, which allows larger circumferences to be measured. It is also wider and has rounded edges to make it more comfortable for the patients. The loops ensure a reliable grip, even when pulling more tightly. When measuring very large circumferences around the torso, the measuring tape can be threaded through one of the loops to form a ring. Use a skin-friendly pen with a soft core for marking the measuring positions in order to prevent skin injuries, for example, a kohl pencil. Make sure you sharpen it each time before use. A relaxed position is important for the patient's well-being. A suitable treatment couch is essential for this. Measure the circumferences A to F with the patient lying down. The patient only stands up before measuring the circumference of the thigh. Measure the remaining circumferences G to T with the patient standing. Measure all lengths with the patient standing, following the shape of the body up to measuring point K1 along the inside of the leg. Measure the foot lengths with the patient standing and weight bearing on that foot. Please make sure you take all the measurements with the patient standing quickly and without any interruptions. Patients with lymphoedema should avoid standing without compression. Measurements to the nearest 5 millimeters are sufficient for the legs. Measure flat knit compression garments accurately under tension. The amount of tension required when taking the measurement depends on the respective measuring point. We differentiate between 3 different measurements. 1. The skin measurement. Here, the actual circumference is measured with the tape held loosely. 2. Pull the tape to the first point of resistance. Here, the measurement is taken under tension while pulling gently. 3. Measurement under full tension. For this, the measurement is taken under forceful tension, thereby compressing the tissue completely with the measuring tape. Normally, you will find 2 columns for entering the circumferences in Medi's measuring forms. 1. The skin measurement. This is used to help document the patient's data and the course of his or her progress. These measurements are important for you as a customer should it be necessary to make any complaints about the fit. They help us evaluate the complaint properly. The skin measurements are not relevant for Medi when making the garments, although we will need the skin measurements if you want to work together with us to solve a fitting problem. 2. The measurement under tension is the measurement you order. This is where you enter the measurements, which we will use to make the garment, even though there are some measuring points that are not measured under tension. The golden rules of measuring. As a rule, flat knit compression garments are consistently measured under tension. Do not measure under tension directly over a joint, for example, measuring point Y. Never measure the circumferences directly in a skin fold, always slightly over it. Always measure leg lengths following the shape of the body along the inside of the leg. First, decide on the measuring positions and mark these on the inside of the leg. For measuring point A, mark above the metacarpophalangeal joint of the big and the little toe, representing the base of these toes. Measuring point B marks the narrowest point of the ankle. It is about 1 finger's breadth above the medial malleolus. To find measuring point B, Run your index finger along the bony part of the medial malleolus to the point where the structure becomes soft. If the patient has visible edema, this point is where the edema starts, never in the joint fold. V01 lies over the distal insertion of the deep calf muscles. For measuring point C, measure directly over the muscle belly at the widest part of the calf muscle. Measuring point D is about 1 finger's breadth below the medial course of the pit of the knee. Alternatively, you can mark the skin 2 fingers' breadth below the kneecap, at the level of the anterior border of the tibia. Our tip: it is often difficult to find the actual measuring positions by inspection or palpation. It works best if you first find measuring positions B and D as shown above, and then measure the distance between the 2 points and divide these into 3 equal parts. This will help you find all the measuring points for the calf simply and reliably. Mark measuring point E over the middle of the patella. In some cases, we measure circumference E with the patient standing. For example, shapes in the area of the thigh that spread out widely, or if the knee area is covered partly or completely by soft tissue overhangs. In this case, mark the measuring point above the patella where the accumulated tissue starts. Measuring point F defines the middle of the thigh between the middle of the patella and the inguinal fold. If you find the measuring point with the patient lying down, mark it slightly above the actual middle of the thigh. Tissue easily slips down when the patient is standing. This also shifts the mark downwards. If you mark the measuring point higher when the patient is lying down, the distances between the knee and the inguinal fold are then equal. Measuring point G lies over the widest part of the thigh, 2 fingers' breadth below the groin, or directly below the gluteal fold. For measuring point K, measure the circumference around both thighs. You do not have to mark this. It is at the same level as measuring point G. Measuring point H defines the widest part of the pelvis or bottom. Measuring point T marks the border of the panty top. It is always above the iliac crest. The large